Today on Plastic Surgery Uncensored, we're going to talk about the ins and outs and unfairness, I think, of diastasis. We have a guest. It's exciting. Stay with us. All right, here we are on another episode of Plastic Surgery Uncensored. I'm Monique Marvez, your stand-up and media personality. This is Dr. Roddy Raban, board-certified plastic surgeon. We're coming to you straight from Beverly Hills, and we have a guest. All right.
Hey, good morning. How are you?
I'm doing good.
All right. So this beautiful and lovely young lady is a patient of mine who is gonna undergo surgery, right?
Mm-hmm.
So
Yeah.
sometimes we're lucky we have guests that have had surgery, and then sometimes we're really lucky because we get the perspective of somebody who is going to have surgery. And this is sort of one of my mission. This particular topic is very near and dear to me, and I've kind of made it one of my callings. And this idea or topic of diastasis recti, which people butcher, we can call it DR if we like. But diastasis recti, let's first define it and figure out what it is. It's when a woman has children, and it's pretty much pregnancy related. Being overweight doesn't really apply as much. But the idea is when a woman gets pregnant and she's carrying a 7, 8, 9, 10, 11-pound child in her uterus, which is in her abdomen, and let's say a woman is a normal 5'4", 5'5", 5'6", that child is going to do a number on the abdominal muscles. So abdominal muscles are those rectus muscles that you use for sit-ups. They are connected when you're young, and as you have these pregnancies and the baby's growing, it's pulling these muscles apart, hence creating a gap known as the diastasis recti. The thing is that once you get the baby gets delivered, they're healthy, you go back to the gym, you diet and exercise, you lose the weight, the gap doesn't seal again. And then you have another child and perhaps yet another child. And with every pregnancy, that gap gets further enlarged. Now, some women are very lucky. Their body doesn't seem to have an issue with that, whether that's genetics, they have small children, they have a large torso, whatever. And some women are very unlucky. And Manasi right now is one of our patients whose abdomen and trunk really changed dramatically, and we're going to dive into that. And as a result, has a very significant functional deformity. And I think it's really important to emphasize that, because when we talk about moms and needing tummy tucks and all that stuff, it's usually about aesthetics. But in this instance, it's equally, if not more, about functionality. So thank you for coming on here. And every time I have a patient on, I'm like, thank you for being courageous. Thank you for being willing to share your story, because nobody wants to really talk about these things. It's very private, and the last thing you want to do is share it with anybody. But I think you understand the value. So let's dive right in there. And why don't you tell me your story about what happened? So you were a young lady, you got married and pregnant, and then what happened?
So I had my son in 2012. My side of the family has a history of big babies, not knowing that I would have a big baby. My son was born at 10 pounds, and he was 22.5 inches tall.
For those of you who don't know, which are all the men, that's a big child.
That's a toddler.
Yeah.
It's not an infant.
Yeah, that's a big. And how tall are you?
I am 5'5".
And how much do you weigh?
Right now?
At the time of your pregnancy?
I was 120.
So 5'5", 120, and you give birth to a 10.5-pound, 23-inch child. So that explains it. So then what happened?
So after he was born, I still had the bulging of the belly for a long time, and I thought it was normal. It somewhat went down, but not all the way in. Then I got pregnant again. So obviously with the growing belly during that pregnancy, I didn't, pay much heed to what was going on before that. My second child was 10.5 pounds and actually quarter to 11 pounds and 22.5 inches tall. So
you think your husband was? Is your husband a basketball player?
No, well, he's 6'1", but
6'1", but he's not 7'1".
So basically, that actually caused more damage, I guess.
Okay, and so what's the damage? So tell me. So a lot of people like to say, "Oh, well, you probably just didn't diet and exercise. You didn't lose the mommy fat."
No, well, so once my daughter was 7 months old, I started working out, watching my diet and everything. So I did lose all my baby weight, except that my tummy would just not go in.
Right. So it was just fully bulging. If you just let it be,
yeah.
You were fit, and worked out and you were a reasonable weight and you just would relax your abdomen, it was like
Yeah, I would look like 4 or 5 months
pregnant. Correct.
Yeah. And I just brought it up to my workout instructor, and she's like, well, maybe either it's the diet or you have diastasis recti.
Right. So that's really great. You got lucky, right? Somebody actually identified it for you, because the overwhelming majority of the listeners are going to be like, ding, 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 light bulb, light bulb. Oh my God, I still look like I'm pregnant and I'm a reasonable weight and I have gone back to the gym, and they don't have a trainer or a healthcare provider that says you have diastasis recti. They have this thing in their head that says you're still fat.
And even if they said it, like if somebody said I had diastasis recti, I'd say I didn't need a dinosaur. You know, I wouldn't.
Yeah, but you would maybe start the Google process.
Yeah. I'd
So
look it
then-
up on my phone immediately.
So then what happened?
That's exactly what happened. I started Googling up, and then
Dr. Google.
there were so many things up there that said that it could probably get fixed without a surgery, which was the first thing I was diving in for, because I didn't want to go under the knife again.
Right. So to that note, so okay, well, you have this diastasis recti thing, no big deal. So what? Women have been giving birth since the beginning of mankind. Go do some exercises.
Yeah, I was. Oh yeah, my trainer actually told me a 30-day regimen, like 5 times a day. I was supposed to do like all these abdominal exercises,
like crunches and things that would strengthen
sit-ups
your
and-
core,
yes,
correct? Okay.
And nothing worked. Like
Zero.
Zero. Not even a bit. Like I saw no change at all.
And do you know why that is?
So
The reason that is because your diastasis recti is so severe. Your muscles are so damaged and so far apart that the idea or notion that doing some sit-ups, what is it that we're trying to do? What is correction? Correction is for those muscles to come back together. So the reason why they say do exercise is if you have the mildest diastasis, by strengthening the other muscles, the abdominal wall will seem flatter. It's not that the exercises bring the muscles together, because it's never coming back together unless someone sews them back together. It's just that it's mild enough that when your oblique muscles are really strong, you can have a flatter stomach. But in the instance of you and millions of other women, not only does that not work, it's maddening.
Oh yeah, it was when I started Googling up, it was I couldn't sleep for a night. I'm like, what is this going on? Because every single image that I would see seemed like they just needed a simple tummy tuck, but not my case. It was just like people who wanted, after their pregnancies, they just wanted a flatter belly, but not to the extent that I had one.
Right.
So I basically said that maybe I need to go see a doctor who can actually like give me more input in this whole new world that I just discovered.
Right. So what we're talking about is that there are degrees of everything.
Right.
So it doesn't have to be, well, like she had 2 kids, I have 3 kids. No.
No.
I have patients who have had 5 children, count them, 5, and their abdomen is flatter than a board. And I've had patients who have had 1 child and it looks like a bomb went off. So the reality is that it's not a matter of absolutes. It's a matter of degrees.
Right.
And in your instance, and why we're having this dialogue is, I guess most people probably understand regular tummy tuck. I got loose skin, I got a little bulge, blah, blah, blah.
Right.
What we're talking about is severe cases of abdominal wall damage that will not be your garden variety repair. And why it's important to listen to this conversation is so you can understand how to navigate this, because if you just go your average route, you're going to end up in a dead-end street. So you went to a doctor to get more information, and what happened?
Well, the doctor flat out told me that this is how it's going to be. There's nothing that can be done.
So he said, this is normal.
Yeah, this is normal.
And what doctor was this, and what hospital, so that we can tell people not to go there?
This was at Kaiser.
Kaiser. Okay, Kaiser Permanente.
Kaiser, yeah.
That doesn't surprise me. Okay, so it's normal.
The doctor basically told me that I don't need any surgery and this is normal, and I should just wear a girdle, which I am wearing. I'm constantly wearing my maternity pants to give more support to my back.
So when was your last child?
2015.
So 4 years ago, you gave birth. You're still wearing your maternity girdle. You're still wearing clothes that really are not ideal for you, and you're basically you're just trapped in this existence.
Yeah, and it's not only about the clothes. Like, I mean, it does help a little bit with my backache, but like if I don't wear those, I have severe backache. bending down, getting back up is
Perfect.
like a challenge.
So that's
She
what
said
we need.
bathing her daughter.
Listen, so that's why we want to the message we want to drive home, because what happens is, again, and I say it in all these segments, it's about shaming and, oh, you should be happy your children are healthy. Oh, you're going to waste money on, what about their college? No, you're a mother. You were a vehicle. You were a capsule from which these children were born. And as a result, you were damaged. And the thing is that the overwhelming majority of women with your degree of diastasis, let alone a little bit, have severe back pain. So why is that? So the reason that is, and it happens to everybody, your trunk is a cylinder, right? It's a round cylinder, okay? And so 90% of the muscles that support this cylinder, the trunk of this tree, are in the front. Your obliques, your transversalis, your rectus, pyramidalis. So your body was designed to put all the strength in the front. And then you have these little wispy, shitty little muscles in the back. They're really rinky-dink muscles that are supposed to support your spine. So when you end up having severe diastasis, aka a hole in the middle of this cylinder, the stability of
blowout.
the stability of your trunk is severely damaged, and therefore when you move, your little back muscles are under extreme they're overworked. They're trying to hold you up. And so that's why girdles are replicating or mimicking your abdominal muscles, and you have to wear. We had a patient on, Monique. Remember Renee?
Yes. Oh,
so I did Renee on Inside Edition, and you guys are like twinsies,
Right.
And she would wear 2 girdles at all times, and she was an ex-figure skater.
The pictures were, the before and afters were unbelievable.
So back pain is such a huge issue, and yes, it would be nice to have a flat abdomen. This is not about a flat abdomen. That's what I refer to as the icing.
And it's not only even simple as sleeping. I cannot sleep on my back. It hurts so much when you get up in the morning. I always have to sleep on the side, either the right, left is more comfortable, but that's how I sleep.
Your child rested on your lap.
Yes, my second child was so low that when I was pregnant, when I would sit and she would move, it would literally she would kick in my thighs.
Well, so you have every right to have the condition you have. Now the issue at hand is, listen, this is part of life. This is how you gave birth. Some people get this. That's not the issue. There's no one's feeling empathy that you had beautiful children. The question is, now that this has happened to you, what are your treatment options? And so the reason why we want to bring attention to this is because if we approach this from a traditional tummy tuck standpoint, which I'm going to elaborate to, we're going to end up probably not happy and probably with some issues. So we're going to come back at the break, and we're going to come back and talk about a couple of key words. I'm going to throw the word out there so people can think about it. And the big word is mesh.
Mesh.
It just sounds awful. So we're going to come back and talk about mesh, some insurance, because you would assume for sure your insurance is going to pay for this because, come on. And then what to expect from the surgery. So tune in and we'll tell you the rest.
We're back on Plastic Surgery Uncensored, and we're talking about diastasis recti, and Dr. Roddy Raban left us with the word mesh. So now we're actually going to dive back into the show and discuss that mesh.
So let's start with treatments. Okay, so we talked about the nonsense treatment, which is I'm going to go do some planks and some sit-ups and some exercise. That's not going to work for moderate, no way for severe diastasis. So the treatment is we need to fix the gaping hole in your abdomen. So let's talk about the difference between diastasis recti and hernia, because that's a huge misunderstanding. Hernia means that there is a hole, a physical hole in the abdominal wall. And from that hole, something is coming out physically. So whether that's an intestine or something like that. So that's a hernia. Now, hernias can be very, very, very small. You can have a belly button hernia, an umbilical hernia, which is tiny and irrelevant, but technically it's still a hernia by definition. Diastasis recti means that the muscles have pulled apart and there's this tiny little thin sheet of nothingness connecting the two muscles. That's the fascia. And it's like cigarette paper. And because it's not physically torn, it's not technically a hernia. Why that's going to matter is we're going to discuss insurance, and we're going to find out that diastasis recti, no matter how severe it is, in your case is super severe, is not covered. So that's the diagnosis. So the treatment for diastasis recti is repairing that hole. And in most instances, it should be sewing the muscles back together. Simple as that. It's called plication, or bringing it together. Basically, like you have a corset or a bustier outside, it's an internal corset with sutures. The problem is that many, many physicians, when they see someone like you, and we will flash your photos on, so if you go online, you can see, they look at your abdomen and they freak out because the amount of separation is so significant that the idea that they can bring it together on its own seems undaunting. So they throw in the word mesh. And mesh means that we're going to bring a foreign material, usually a plastic type material, and fill in the gap that's there and bridge it with this material to create a fence or support structure. Okay? The problem with mesh is it's exactly that. It's foreign material. And you can go online and read thousands of studies of mesh that create inflammation, chronic pain, issues that have to be removed, etc. When you have no choice, mesh is mesh. You don't have a choice, you have a choice. But I firmly believe, and I have demonstrated time and time again, that the diastasis can be corrected without ever needing the use of mesh. So one thing we want to drive home today for our listeners is that if you are like, oh my God, this sounds like me. And I went to a doctor because Renee, our last patient.
Didn't she go to several?
She went to like 8 guys and like 4 of them said she needed mesh. And she did her homework and realized, and she avoided it. We want you to tell you that mesh is for sure not necessarily necessary. Okay? So what we need to do is, it's essentially a tummy tuck, but much more aggressive, because you can't just fix the muscles with leaving the skin there, because you have a tremendous amount of skin, which goes hand in hand. So we lift up the skin in a tummy tuck fashion in order to get access to muscles. We fix the muscles, which then flattens your abdomen and then supports your back, right? Yeah. Supports your back, and then we remove the excess skin through that. That's the treatment. But the key is, because your case is so severe, you might need layer upon layer of plication or muscle sewing. In other words, you can't just sew it together one layer and call it a day. You're going to have to keep bringing it in and bring it in, because your whole abdominal wall is loosey-goosey, right?
Right.
So that's
a medical term, loosey-goosey.
Oh, yeah, loosey-goosey.
Yeah. You wrote it on your chart.
That's in, I coined that term. So I think it's really important to understand those key aspects. What do I have? Maybe diastasis recti. How severe is it? Pretty moderate to severe. What do I need, and how to get it done? You kind of want to go to someone who's an expert in abdominal wall reconstruction, and I would stay clear of general surgeons. It all depends on how you get to your endpoint. If you went to your internist who they've never seen this, they're going to send you to a general surgeon thinking you have some hernia. If you go to your OB who's intelligent and works with a plastic surgeon, they may say you need to see a plastic surgeon. But at the end of the day, it's on you. That's why you listen to programs like this. Okay? So
to be clear, the mesh that's a final last resort situation, but people use it as a first resort because they're, can I say lazy?
No, it's not because they're lazy. They just don't know any better.
Okay, fair enough.
Because putting in mesh is difficult as well. And I suppose it's a last resort. I've never had to use mesh, and I've done some severe cases. I think the tissue is all there. Why we use it in a hernia is something is missing. In her instance, nothing is missing. It's just torn apart. So all the material is there. You just have to delicately and carefully bring it back together. So that segues into insurance. Have you tried to get this covered?
Well, since I have Kaiser, they don't cover anything. Outside of Kaiser, and they are not ready to do the surgery, so no, I'm not getting covered for this.
So you would think that, okay, I have this gaping hole in my stomach, I have severe back pain, I can function, I wear girdles. I mean, this is a no-brainer.
You would think.
It's not covered. And it's interesting because we're such in a movement of Me Too and female empowerment. If I were, as a male, to show up to my doctor's office with a tiny little groin hernia, basically a little hernia in my groin, which is uncomfortable, fair enough, and will probably eventually grow and cause
The hernia
problems.
is small, not the groin. Yeah, I
Oh,
just wanted-
good point. Yeah. The groin is not small, but they would cover it because there's an actual code in the mediculture in the insurance world that says hernia correction code 11225, whatever the hell it is,
Right.
and they would get covered. You walk in there with this gaping hole in your abdomen that most physicians will have never seen, and there's no code for it, and we cannot for the life of us figure out why.
It sounds, dare I say, sexist?
I mean, listen, I don't think whoever came up with insurance back in the day said, all right, let's just screw women. I just think it's time for, I think it was overlooked, as are many
Okay.
things.
Okay.
And I think it's time for a modification. We just need to make the modification. We're there now. Just like infertility wasn't covered. It wasn't even
Bariatric wasn't covered.
bariatric wasn't covered. Loose skin after bariatric. Like, we've made advancements, and as a result of advancements, we have new things that we need to cover. So we want to really drive this message home that everyone needs to go and complain to their insurance carriers and say, this should be covered. This should be covered. Maybe we can create a whole new movement, but I really think this should be covered.
It definitely should.
Absolutely. I think in solidarity, people should have like sacks of cement in their pants. And because the way she was describing her life,
I think I think we should create a hashtag, because hashtags seem to create,
yes.
like, what do you want to call this one? Hashtag what?
This is going to be a tough one. I think hashtag no smelly belly.
No, that's not going to work. Nevertheless, hashtag DR, which is Diastasis Recti.
Yeah.
Mm-hmm.
So let me just give this last part, and then we're going to end this segment, which is about recovery, because obviously you're going to do this thing and you want it.
Right.
So what's unique about these patients is they have kids.
Yes, I know.
And usually their kids are small, and usually their kids are needy, and usually their kids need them to lift them and move them. And this is a time where you need to be selfish. You need to say, I'm going to...
Time out. Selfish and mother in the same sentence? Are you insane? This is America.
So that means that you need to get help. Husbands need to step up. Sisters, mothers, fathers, neighbors, and children that are of appropriate age need to kick in and do what it takes to allow the mother to recover from her sacrifice. So recovery is as follows. It's going to be 2 weeks off from any job. I don't care what your job is. Desk job, I work in a spa, it doesn't matter. Then you're going to need 6 weeks in total off from any intense physical activity, lifting weight, etc. So if you are lucky and you have an administrative type job,
Which I don't.
you can go back to work in 2 weeks. And that's quite feasible, even with the size of diastasis you have.
Right.
Renee, who we spoke to, was on the ice for the first time without a brace at 6 weeks. At 6 weeks, you can then resume physical activity. And not only can you resume it, but you're going to be stronger than you ever were before because your muscles are working the way they were supposed to work.
You're no longer relying on the rinky-dink muscles of your back.
Yes, and so the key is to make sure when it comes to diastasis or any surgery, but definitely this one, you have a really strong support system in place and people around you who love you and want the best for you and want to give you an opportunity to do what's rightfully yours.
I like the way you put that, Dr. Raban. It sounds very, it sounds pro-mom. Maybe that's it. Hashtag go moms. Something like that.
We're going to come up with something else.
We're going to come up with something good because DR, the Dominican Republic, will start, riding our coattails. So we can't do that. So that, I think we've covered everything.
We sure have.
So final thought, and we've used this one before, support. Not just physical support, not just on your back, support. Emotional, family, lifting the kids up, helping you out. We're wrapping up another segment of Plastic Surgery Uncensored. We're grateful that you hung out with us.
Thank you for coming, honey.
And,
My pleasure.
And please stay tuned for the next episode of Plastic Surgery Uncensored with me, Monique Marvez, and board certified plastic surgeon, Dr. Roddy Raban.